Hello everyone, welcome to my channel. Hope you guys are doing well. In today's video, I'm going to discuss about the pediatric assessments format, which is mainly focused on cerebral palsy. You can also use it for other developmental delay disorder. Now, I have already made a video on the general assessment format in SOAP protocol. You can also check that out. Click on the I button to see that, right? So without getting any delayed, let's get started. But before that, a short introduction. Hi, myself Shanglap Kundu, and I have passed my BPT from National Institute for Locomotor Disabilities. Okay, so the first thing you need to note down is the demographic details. Now under this comes your first the name of the patient, second the age. Now here first you need to mention the chronological age and the second is the corrected age, that is the chronological age minus the preterm age, right? Now then you need to mention the sex of the patient, male, female or transgender, right? Then you need to mention the address where the child live, right? So and then the important thing, when did the mother first notice the dysfunction? See, the child doesn't know if she or she having some sort of dysfunction, right? It is their parents, and most of the time it's their mother. They first notice the dysfunction, so you need to mention that, right? Then siblings having same type of symptoms, so siblings like brother, sister, having this type of symptoms or not, right? So then there is the present weight. So when the child with their parents is coming to you, you need to know the current weight of the child, right? Okay, so now you need to note down the present complaints of the baby. Now remember, the baby will not be able to communicate with you. So it will be their parents from whom you need to take the complaints, right? So now comes your history taking. Under this, you first need to note down the review of complications of pregnancy and delivery, like preeclampsia, gestational diabetes, and so on. Then comes your birth weight, that is the weight of the baby at the time of birth. Then you need to note down the gestation period, that is the time period for development of the fetus into the baby, right? Then you need to note down if there is any neonatal and perinatal difficulties, right? Then you need to note down if there is any feeding problems, and lastly you need to note down if there is any other health related issues, right? Okay, now under history taking, you need to mention first the developmental milestones, right? I have already made a detailed video on this, right? So here you need to mention what are the developmental milestones that the child has achieved, and these age, like the chronological age, what the other milestones he or she needs to be achieved, right? Now, after that, you need to mention the prenatal history. In prenatal history, first comes here the age of the mother at the time of conceiving, right? Then you need to mention if the marriage is a consanguinity marriage, that is the same relationship marriage, right? Then you need to mention if there is any specific drugs taken during pregnancy, right? Then you need to mention if there is any addiction of mother uh, during the time of pregnancy, or at least before 1 year of the pregnancy, right? Then you need to mention if there was such infection like the torch infection, right? It is very important, the torch infection. Now it also comes as your short note. Now remember, torch means TO for toxoplasmosis, R for rubella, C for cytomegalovirus, and H for herpes simplex virus, right? So this sort of infection can cause a delayed developmental disorder for the children. So you need to mention that, right? Then comes your history of previous abortions, stillborn or death after birth. Now, when you are mentioning there is a specific criteria like G2 plus 2, right? So you will learn that eventually in your obstetrics and gynecology class. So I don't need to mention that, but please remember you need to mention that previous abortion history or stillbirth history, if any. Then you need to mention if the pregnancy was a multiple pregnancy, right? Then you need to mention the status and the caste of the mother, right? Like you need to mention this to get an idea about the socio-economic background also, and also gives you an idea about the health and hygiene followed by the mother, right? Okay, so now you need to take the perinatal history. Under this first comes your place of delivery. That is, you need to mention where the baby is being delivered. If it is either it is a home environment or it is a hospital environment. Then you need to mention the history of problem or the post-term delivery. That is greater than 42 weeks of gestation period, right? Then you need to mention history of asphyxia at birth. Asphyxia means deprivation of oxygen at their organs, right? History of prolonged labor pain. Now, labor pain is a normal phenomena, but if it is prolonged, it is not normal. So you need to mention that. Delayed birth cry. Now remember, birth cry is a very important thing because when the baby is in mother's womb, the oxygenation process is passive, right? But when they are out of their mother's womb, they need to interact with the environment by inhaling oxygen and exhaling the carbon dioxide. So it needs to be an active process, the inspiration process. Now, first when the baby basically taking the oxygen, right, the alveoli first expands, right, which is a painful process. So the baby cries and it is a natural phenomenon. But if the baby is cried, later than the normal time period, so basically the baby's organs are being deprived of that period of time with oxygen. So there may be a developmental delay or disorder due to that, right? Then the type of delivery, right? Either it is a forceps delivery or if it is a vacuum delivery, right? Then you need to mention the weight of child at the time of birth, right? Then you need to mention the condition of the mother at the time of delivery. So if there is any complication or not, or other things, right? Now here in the picture I have I have given this picture to get you an idea about this forceps delivery, right? So here when the baby is being pulled out from their mother's womb through the vaginal orifice through this forceps, there may be chance that gets injure the brain somehow. So that also needs to be mentioned in your history, right? Okay, so now you need to mention the postnatal history, that is the history after the baby is being born, right? Under this first comes your APGAR score. So APGAR basically will give you an idea if the baby needs an immediate medical attention or not. There is a scoring system in the background picture, you can see that, and I won't describe it in more detail because I have already mentioned it in details in a video. Please check on the I button to see that, right? Then comes your history of trauma to the brain during the first 2 years of life, right? So if the patient is coming to you after like in 5 or 4 or 5 years, then you need to know, right, if there is any trauma to the brain and if it is untreated or not, and if it is being treated, how it is being treated, and so on, right? Then you need to mention the history of neonatal meningitis. It is very important because the brain is developing at that period, and some sort of viral infection or any bacterial infection that can cause meningitis is harmful in their developmental process. And you would also need to mention if there is jaundice like kernicterus, like hypoglycemia, hydrocephalus, microcephaly, etc. Then you have to mention the nutritional habits of the child if there is any feeding difficulties, right? So yeah, this will give you an idea if the baby is malnutritious or something like that, right? Then if there is any medical, surgical or physiotherapy treatment taken before, surgical, like if the baby has some VSD or ventricular septal defect, and if the baby is then gone through some sort of surgery, then you need to know what are the surgeries that have taken place, and for that what kind of physiotherapy, or if there is any medical condition which were being treated by drugs or by any surgery, or after that physiotherapy, you need to know all of that, right? So if that is a yes thing, then you need to know what treatment was given and the effectiveness of the treatment and the ability of child at that time, right? Okay, so history taking is done. Now you need to go to it on observation part. Now first is the behavior of the child, right? First you need to see if the child is alert or not, if the child is irritable or fearful in the physiotherapy session or during any particular activity. Now you need to check if the child becomes fatigued easily or not doing so much activity. Then you need to check what motivates his or her action, right? If it is any particular situation, any particular person or any special plaything, correct? Okay, now you need to observe the communication of the child with their parents and their surroundings. Now you need to check whether the child initiates or responds with gestures, sound, any hand or finger pointing, eye pointing, or any usual words and speech, normal for their age, right? Okay, so now you need to observe the attention span. Under this, you need to check what catches the child's attention. If it is any a colorful toy or something like that. And if it is really catching the child's attention, then how much time that the child spends, to that particular thing with proper attention. Then you need to know how does the parent assist him to maintain attention to that particular thing. Then you also need to know what exactly distracting the child. If it is an event, like if the abnormal movement or any posture or any pain, you need to know about that, right? Okay, so the next thing you need to observe is the understanding of the child. How much the child follows suggestions that is being prompted to them, and what does he appear to understand, right? If you are telling the child to go right or in right direction, does the child actually goes in right direction, or the child basically sits there and does nothing? Or if the child is going to the left direction, that is the opposite direction. So you need to have an idea what does he appear to understand to your cue, right? Then you need to observe the position of the child, right? What is the preferred position by the child, right? Then you need to observe, can the child achieve that position by himself, or if or he or she requires some sort of assistance in that position. And if the child is taking any assistance, then does the child makes any effect to go into that position? Symmetry of the child, that is actively or passively maintained, right? Then if voluntary movements present, then in which positions these movements are decreased or increased, right? Then you need to observe the postural control and alignment. Under this, you first need to check how much parental support is given to that child to maintain their postural control. How much the child be able to maintain the postural stability and postural adjustment in all of the postures, right? The proper and equal weight bearing, if the child can does that or not. If the child's center of gravity appears to be unusually high, resulting in floating of the legs and poor ability to raise head against gravity, then you need to mention that also. Then you need to know if there is any fear of fall in child due to that poor balance, right? Poor postures are all basically seen in all types of CP. The more commonly deformities are the kyphoscoliotic posture, the knock knee or the genu valgum. There is this fixed flexion deformity, the inverted flat foot, and so on. Now you need to observe the use of their limbs and hands, right? So these are basically the limb patterns in changing or going into position, as well as using them properly in that position, right, without losing any balance. So here you need to observe the attitudes of limbs during that playing activity and in all other positions that the child needs to maintain. Here you need to note whether the child is using one of the hand or both of the hands, and if the child is grasping something or holding something in their hands, what type of grasp is that, and if the child is releasing that object, how the child basically does that. Then you need to check the accuracy of their reaching and hand actions, right? Then you need to observe if there is any involuntary movement, any tremors or any spasms which interfere with actions, if any, right? Now you need to check the form of locomotion. Under this, first you need to know how the child is being carried. If the child is using any wheelchair or any walking aids, or if the child is walking on their own, and if so, then what is the gait? If it is in pathological one, that mention that, right? Then you need to mention which daily activities motivate the child to do the functional activities, which are rolling, creeping, crawling, bottle shuffling, or walking, right? Okay, now you need to observe if there is any deformity or contracture, right? Now you need to see if any part of the body which remains in any particular position or any fixed position in all of the postures and in all of the movements. So basically that is a deformity which the child has already possessed in this period. So you need to note that. Other things you need to observe is if there is any involuntary movements, if there is any scar, if there is any trophic changes, and so on, if you think those are necessary in your observation part. Okay, so the observation part is finished and now we are getting into the examination part. The first thing you need to examine is the higher mental function. Under this, first you need to check the orientation, right? So in most of the cases in delayed developmental disorder, the child appears to you as drowsy and lethargic. So their orientation will be poor, and you will get an idea about that when you are trying to communicate with the children. Then you need to check the memory. There is long-term memory and short-term memory, and in both of those things the child appears to be poor, all right, in recognizing something. Then you need to check if the child is mentally retarded or not, and there are many questionnaires on this, or you can take help from a clinical psychologist. Then the vision, right? You need to check the vision. In most of the cases it is poor, right? Then you need to check the hearing, and again in most of the cases the hearing is poor, or the child basically sometimes not reacts to any external auditory stimuli. Then you need to check the attention span. I already mentioned in the observation part. You need to observe how the child is basically giving attention to a thing, and here you need to examine the span of that period by giving any object or any favorite thing of that child, right? And then you need to check the speech and language. You can take help from a SLP, that is a speech language pathologist, and basically you can also communicate. When you are communicating with the children, you will get an idea about that speech and language, right? The next thing you need to examine is the cranial nerve, right? Now, it is not always possible because depending on the child's age, both chronological and mental age, it is difficult to perform over them. And by chance, or if you can perform the cranial nerve examination properly, you might find out there is strabismus or squint if the oculomotor nerve is involved. You can find out the visual defect if the optic nerve is involved, hearing defect if the auditory nerve is involved, and if the bulbar nerves are involved, that is the 9, 10, 11 and 12 cranial nerve, you will get to see the feeding and swallowing defect, right? Now the sensory examination. It is also difficult to assess sensation in babies and also in young children with several multiple impairments, because they won't respond to you and it is going to be difficult, and proper skills physiotherapist can do it, right? So here the first superficial sensory examination you can check is the pain, temperature, light, touch and pressure. I already mentioned that all of this in the general assessment format in my SOAP protocol. So I will suggest you guys to please check that video. Link will be given in the description box, and also you can check the I button here to see that, all right? Then there is this deep sensation, then this combined cortical sensation, all I have mentioned in that video, correct? Okay, so now you need to check the reflexes. Under this, first you need to check the spinal reflexes, which includes the flexor withdrawal thrust, the extensor thrust, the palmar and plantar grip, the sucking and rooting reflex, and the primitive walking. Then you need to check the brainstem reflex, which includes the STNR, that is the symmetric tonic neck reflex, the ATNR, that is the asymmetric tonic neck reflex, the TLR, that is tonic labyrinth reflex, positive and negative supporting reaction. The next reflex you need to check is the midbrain level reflex, which includes optical writing, labyrinth reflex, body on neck, body on body, neck writing reflex. The last reflex you need to check are the cortical level reflexes, which includes the equilibrium positions, basically the equilibrium in supine, prone, quadruped, kneeling, sitting and in standing. Now all of these reflexes you need to get into all of that in details in the physiotherapy in neuro conditions, which is written by Gladys Samuel Raj. I have already mentioned which of the books you need to read for your final year examination. You can check out that video. I have already mentioned that book in that video. So please check out that. Link will be given in the description box below. Okay. The next thing you need to check is the motor examination or the motor part, right? Here, first thing you need to check the tone, right? And in most of the cases, there will be abnormal tone. Now, depending on the case, right? Now, if I'm describing you a CP child, in most of the cases, the CP presents with a spastic tone, right? That is the increased tone, spasticity. In other cases, there may be hypotonicity or dystonia, right? Then you need to check the muscular weakness, right? Then you need to know about the voluntary muscle control that the child can perform. Then you need to check if there is decreased coordination, right? If the balance and coordination is less in them. Then you need to check the range of motion and flexibility part. Now here you can check the active range of motion and the passive range of motion. Also you need to check the joint flexibility, the muscle length, soft tissue tightness, and so on. Now here I will mention the joint range of motion, the active range of motion and the passive range of motion in more detailed format. Now the first thing you need to check the head and trunk flexion, extension, rotation, if those are active, and if it is during head raise in prone, supine, sitting and standing position. Then you need to check active shoulder elevation, abduction, rotation, flexion and extension observed during functional examination of creeping, reaching and other arm movements. Then you need to check active elbow flexion and extension observed during child's reach to parts of bodies or toys. Then you need to check the active wrist and hand movements during all of the functions. Then for lower extremity, you need to check the knee flexion and extension seen with hip flexion extension movement. Then you need to check the foot movements during all the functional activities. So basically here the thing is you need to check from head to toe, and to do that basically the child will not listen to you. So you need to give them some toys or some activities which they found interactive and they will listen to you, and in that period of time you need to check all the joints range of motion and how much they can do that, and if I can do that actively, you need to check all of that. So that's it. Okay, the next thing you need to examine is the anthropometric measurement. It includes basically the height, weight and the head circumference. So in height basically it is a decreased, and in most of the cases there is growth retardation, right? So until 24 to 36 months of age, length is recumbency is measured during using an infantometer, right? After 2 years of age, standing height is recorded by a stadiometer. Now you will find both of this in a pediatric setup. Then you need to check the weight of the baby, right? In most of the cases it is decreased and the child is basically malnourished. So the normal weight at birth is 3.25 kgs, and at 3 to 6 months the age in months and the weight needs to be the age in months plus 4.5. During 1 to 6 years, the weight needs to be age in years into 2 plus 8, right? And then 7 to 12 years, the age is in years into 7 plus 5 divided by 2, right? So then you need to check the head circumference. To check that, a tape is used to measure the occipitofrontal head circumference from the external capital occipital protuberance to the gabella, right? So the normal head circumference is at birth it is 35 centimeter, at 3 months it is 40 centimeter, and at 1 year it is 45 centimeter, 2 year it is 48 centimeter, and at 12 year it is 52 centimeters, correct? Okay, the next important examination is the examination of balance and gait. Now in balance, you first need to check if there is any compromised static and dynamic balance. So balance is mostly or severely affected in athetoid and ataxic CP because the cerebellum is involved here. Then you need to check the common gait deformities, right, in delayed developmental disorder. These are the crouch gait, where all the joints of lower extremity, that is the hip, knee and ankle, goes into flexion. Then comes your genu recurvatum, where the knee gets into hyperextension. Then equinus foot, or basically the toe walking, right? Then there is hind foot. Then there's decreased speed in gait, which is mostly seen in spastic CP due to the increase of tone. Now remember, there are some things about this walking, right? There are some theoretical points which are The independent walking is rarely achieved by spastic, quadriplegic and athetoid CP. Few diaplegic can walk with walking aids, whereas in case of hemiplegic CP, they can achieve independent walking. Now remember, these all points are basically an idea, theoretical idea about the goals you can achieve with a CP child, right? So this is, as I said, it is theoretical, right? In practical, things might change, right? So you need to do it all in practical cases. Okay, now it is also an important part to examine, that is the bowel and bladder, right? You need to check if there is any sort of incontinence or not. But the thing is that the child in most of the cases won't be able to communicate with you, right? So if they can communicate and understand you, then you can do good with the bowel and bladder training, right? In profound mental retardation cases and those who unable to communicate with you will have dependent function. They will show these incontinence and you hardly can help them, right? Okay, so the last thing we need to examine is the tightness, contracture and deformity, that is the TCD. Right. So in lower extremity, the TA, that is the tendo Achilles, which is gastrocnemius and soleus attaching with this calcaneum, and there is this hamstring muscles, which are more involved, right? Because there is this ankle equinus contracture in most of this child, right? Then for upper extremity, flexors are more involved than the extensors, so the patient attains a flexion posture in the upper extremity. So you need to check the tightness and the deformity, right? Okay, now you need to examine the functional measure, right? Under this, you need to check the GMFCS level, that is the gross motor function classification level. Now, I have already made a video on this in details, so I'm not going to mention it here. So please check that video out to get to know more about this level scale right there. Okay, so yeah, that's all. I know it's a long video, but if you guys have watched it till the end, then I am definite that you guys get to know a lot of things, and I think it will help you throughout your pediatrics part, right? Because this sort of pediatric assessment is very common with your question paper also. So thank you so much. Thank you so much for watching the video till the end. And I would request you, all of you guys, to please join me on Telegram, because I am going to share all my notes and all the books, relevant books in that channel. So don't forget to subscribe that, right? So now if you love this video, because I know you have loved it, because you are till now at the end of it, so please like, share and subscribe to my channel, and also other social media handles like the Instagram and the Twitter. Okay, so that's all for the video. See you in the next one. Bye bye guys.